We're following breaking news tonight at 5 o'clock. Our state is now taking another step to keep you safe during this pandemic. Governor Eric Holcomb announced a couple of hours ago that he's now extending Indiana's stay-at-home order. Anne Marie and I have been watching these developments closely as she continues to practice social distancing. Rich Nye, though, tonight joins us at 5 to explain what this extension will mean to you.
The stay-at-home order now extends for the entire state through April 20th. The number of coronavirus deaths now tops 100 in Indiana, 102 to be precise. And while most Hoosiers are not infected, almost every Hoosier is affected. State officials focus much of today's daily news briefing on mental health.
This slowly unfolding, constantly changing, life and livelihood disrupting crisis is unlike anything we have ever seen, and is going to cause many people to experience increased anxiety and depression. Our message to Hoosiers going through this is twofold. One, it's normal to feel this way. And two, help, and help that works, is available.
Dr. Sullivan says calls have increased across the state to addiction and crisis hotlines. Mental health services are available by calling 211. Part of the news conference was a doctor taking viewers through a series of questions about anxiety and then advice for how to cope with that. It was almost like a counseling session for the entire state. And Governor Holcomb himself said he took a few notes.
The numbers continue to climb all across Indiana. In fact, coronavirus is now in 85 of our 92 counties. And we've just experienced the highest number of deaths in a single day. 24 Hoosiers died over the last 24 hours, including 9 here in Marion County. Let me give you some of the numbers that we're seeing. Over 3,400 confirmed cases statewide, and our death toll here in Indiana is now 102. 102 families are grieving tonight the loss of a loved one from coronavirus. Here in Marion County, we are feeling the impact of COVID-19 with 1,429 confirmed cases and, unfortunately, 33 deaths here in Marion County.
We're waiting to hear this afternoon from the White House, and when we do, we're expecting them to address a question that a lot of us have been asking right now. It's about whether or not we should be wearing face masks when we're out and about. Like when we go to the grocery store, should we cover up? They are expected to urge people who live in some of the hotspot areas like New York City to wear masks. But we don't know if that's going to include a recommendation for places like Indianapolis. Now, you might recall it was last week that the Surgeon General called Indianapolis an emerging hotspot. The CDC initially advised against wearing masks unless you happen to be a healthcare worker or if you were a first responder. But now the CDC believes that people without visible symptoms could in fact be spreading the virus. We did get a chance today to ask the state health commissioner about this and the recommendation during the press conference this afternoon. This is what she said. She goes, if you're going to wear a mask, make sure it is not one of the N95 masks that is desperately needed by medical teams and first responders. So stay away from those. Of course, securing more protective personal equipment for frontline medical workers is really a top priority for everyone here in the state of Indiana. So much so, in fact, that today the State Department of Labor reached out to all Hoosier businesses, asking them, do they have a way to help? Dustin Grove shows us now a look at what is needed and who is answering the call and actually stepping up.
We're on the front line and you need us. We need to be there and we need to be healthy.
Across the country, healthcare workers are short on supplies and asking for help. They need gloves, gowns, and especially masks. Here in Indiana,
the Indiana Department of Labor Commissioner Rick Rubel.
We were invited to listen in as the Labor Department held statewide conference calls asking Hoosier companies for help and ideas. In an emailed invitation, the state said it believes this is the best way to quickly locate this equipment and secure it to help protect healthcare workers, first responders, and essential social services personnel on the front lines. The Robert Weed Corporation is among those who've responded. The fabrication company from Bristol is offering plans for privacy panels that could be used in a makeshift hospital.
Places for beds, patients, staff.
And protective face shields for doctors and nurses.
At this point, we've got all hands on deck and everything's on the table just to see how we can help.
And check this out. Zionsville native and Purdue alum Tyler Mantell helped start the Ventilator Project, recruiting a team of engineers and entrepreneurs to design and produce low-cost ventilators at a time when hospitals are concerned about running out.
As a team of roboticists, it seemed like an area that we could very easily get involved.
Once finished and approved by the FDA, they hope to have them in hospitals as soon as next month.
We've never seen anything like this before, so it really it means a lot that we can do something to help.
I talked with a hospital administrator this afternoon who told me if you showed up with a truck full of N95 masks, he'd take them all today. Anne-Marie?
And we know that so many organizations have been stepping up to help. Thank you so much, Dustin. We want to show you the look at what the Indiana Department of Environmental Management did today. They donated all of these gloves, safety glasses, and suits, all to help in that statewide effort against the virus.
Example of Hoosiers stepping up, and thanks. Well, life is really changing for all of us. And as we first told you yesterday, schools will now be closed the rest of this school year. Students will now be learning at home for weeks. Our Rich Van Wyk shows us tonight what you and your kids can expect.
Schools and teachers right now are scrambling to find the laptops, the lesson plans, and the internet connections so children can learn at home. Schools will be full of empty desks for the rest of the year. Each district is finding its own way to keep kids learning. At IPS, home learning begins Thursday. High school students will get loaner laptops. Lower grades will get homework packets. Teachers will use websites, emails, and telephone calls to work with students who may or may not have internet access. Home learning days begin Tuesday for Washington Township students. 2nd through 12th graders receive laptops. Younger students get learning kits. They will receive assignments online. Teachers will answer questions and grade students' work. Internet access is an issue.
It's a new world for everybody.
From what Superintendent Matt Prusecki describes, Decatur Township School's e-learning program is ahead of many others. All students except kindergartners have their own computers and home internet access.
All of our teachers will Zoom conference with their students, in addition to preparing for classes and then trying to grade the schoolwork necessary.
Which won't be easy. E-learning was designed to teach children for a couple of school days a year, not a couple of months. For parents, students, and teachers,
you have to settle into what I call productive discomfort.
The governor is giving schools lots of leeway, but whatever learn-at-home plan they come up with has to be turned into the state within 2 weeks for approval.
We learned today that there's a new letter. It was written by state leaders, and it could allow the release of certain inmates. This is what we know. This was a letter that was signed by Governor Eric Holcomb and others, and in it, it mentions inmates, juveniles, staff, and service providers, and how they live and work in confined areas, and that makes it easy for COVID-19 to spread. The letter goes on to suggest that each facility should now evaluate whether or not to safely release these low-risk, nonviolent juveniles and also other offenders. Scott.
We've got an update for you tonight from Indigo after an employee urged coworkers to get tested for COVID-19. As we first told you yesterday at 5, that employee tested positive and had concerns about social distancing. Well, today Indigo told us they know of 5 total employees who have now tested positive. Indigo went on to tell us they've taken lots of steps to prevent the spread, including things like antibacterial stations at its facilities and new temporary break locations. They're also asking people to board in the back of the bus to create space between them and the drivers. Ann?